From the Fox 6 Health Center tonight, something is going around. You know, you cough, you sneeze, you get all stuffed up.
So if it lingers for more than a week, time to see the doc. Something is missing from this picture. Lynn Konowalski shakes hands with her doctor, and she's not clutching a tissue.
How are you doing?
A few weeks ago, she carried one everywhere when her cold-like symptoms first kicked in. She couldn't shake the misery.
I want to go back home and crawl in bed because I just don't feel good.
Runny nose, congestion, headaches, you lose your voice. If it doesn't get better, that's when you see the doctor. It turns out Lynn did have a sinus infection. Some people are simply prone to sinus infections after a cold. Often the passages to the sinuses are so small there's not enough room for proper drainage. Well, this year more people are reaching for the Kleenex and coming in for help when they don't normally have problems.
It's been probably the busiest March that I can remember.
Once spring kicks in, most sinus issues are from allergies. But this year, Lynn's doctor is seeing a lot of winter viruses sticking around longer than usual. Your garden variety cold shouldn't last more than 10 days.
If in a week things are not improving, or especially if they're getting worse as time goes on and that drainage is just persisting or increasing, then that's a sign of trouble.
At that point, you've probably developed a bacterial sinus infection
And we've got a little bit of gray in there, which is chronic infection.
and might want to consider an antibiotic to knock it out. The reason doctors won't give you an antibiotic right away, you always want one, right? Well, because viruses don't respond to the medicine. If the nasal congestion, what I call the gunk in there, gets stuck in the sinuses, then it's bacterial. That's when an antibiotic will work. Meantime, the best you can do for that cold or virus is an antihistamine to dry you up and something over the counter for any pain that you might have.
So what are you hacking on, a bacterial virus? What
Well,
do you
now
mean?
it's bacterial. I got sick maybe last Thursday. I started feeling sick, and I finally just got my antibiotic.
Well, there
today.
you're all set then.
I'll be good.
Clean.
And
Good as
I won't
new.
give you anything. By now, I don't think I'm contagious anymore. I just have that low, sexy voice.
No problem, I'll just sit over here. Just kidding. Hey, the runaway bride, remember her? She made headlines all across the